Joint injection should only be performed by trained medical professionals. This video is not a substitute for supervised procedural credentialing. Olecranon Bursa aspiration. Olecranon Bursa aspiration is useful for the relief of swelling in acute bursitis and for the diagnosis of gouty bursitis or infectious bursitis. Olecranon Bursa steroid injections are useful for the treatment of chronic bursitis. Most acute traumatic olecranon bursitis episodes are self-limited. The olecranon bursa overlies the olecranon process at the proximal ulna. Here is a diagram showing an inflamed bursa. Olecranon bursitis is visible as posterior elbow swelling and is often described as a golf ball or goose egg over the elbow tip. The supplies needed for an olecranon bursa aspiration include gloves, alcohol swabs and chlorhexidine or betadine swabs are used to clean the surface of the skin. To aspirate, you need a 5 to 10 milliliter syringe with a large 18-gauge needle. To inject, you need a 3 milliliter syringe with a 25-gauge 1-inch needle. You need 1/2 to 1 milliliter of 1% lidocaine and 1/2 milliliter or 20 milligrams of Kenalog or its equivalent. Ethyl chloride can be used to numb the skin so the patient doesn't feel the needle as much. Gauze is used to apply pressure when the needle is removed, and then a Band-Aid is applied. Place the patient's elbow on the table at maximal elbow flexion to accentuate the swelling. Palpate over the olecranon bursa for fluctuants. Clean the skin with an alcohol swab and a chlorhexidine or 3-betadine swabs and allow the skin to completely dry before proceeding with the injection. Apply ethyl chloride until the skin turns white. Aim the needle directly at the olecranon bursa. Aspirate bursal fluid until the bursa is flat. You can compress the bursa to help with the aspiration, taking care not to touch the needle. If infection has been ruled out, inject the steroid lidocaine mixture into the bursa. Remove the needle and apply pressure with gauze. Then apply a Band-Aid. This is another example of an olecranon bursa aspiration. If the bursitis is chronic, even after aspiration of the fluid, the bursa can still look enlarged due to the thickened bursa wall. A compressive neoprene elbow sleeve may help prevent fluid reaccumulation. Avoid direct pressure or trauma to the elbow. For recalcitrant olecranon bursitis, consider a posterior splint or elbow pad for 1 to 2 weeks after the steroid injection. Instruct the patient to return to your office if they develop redness, swelling, or increased pain at the injection site. The ICD-9 and CPT codes that you would need to document the procedure for the visit encounter are listed. This is a summary slide showing the needed supplies. This is a summary slide describing the technique for an olecranon bursa aspiration or injection. We hope you enjoyed this presentation on Olecranon Bursa aspiration.